Thank you for tuning in to our little discussion today. I hope everyone is being safe. My name is Dr. Craig Meyers. I'm a professor of microbiology and immunology, obstetrics and gynecology at the Pennsylvania State University College of Medicine. Today I'm going to talk to you about some studies that I have been doing with Tristal on their chlorine dioxide chemistries to inactivate human papillomavirus. So let's get into the talk a little bit here. So first off, just a little bit, what is HPV? Why is it important? Why are we wanting to focus on it? Well, as most of you know, HPV is a non-enveloped virus, and that means it can be more robust and more resilient to disinfection. My previous research has shown that HPV cannot be inactivated by some FDA-approved high-level disinfectants and sterilants. So consequently, research evaluating disinfection methods available on the market for device contamination is critical to make sure that they are efficacious before being used. More than 200 different types of HPV have been identified, and for the human types, they are categorized either as high risk or low risk. High risk meaning associated commonly with cancer, or low risk where there's a rare association with cancer. The main virus types to note are HPV strains 16 and 18. These are the two most common types making up the majority of anal genital and oral pharyngeal cancers. Now, transvaginal probes, including their cords, plugs, colposcopes, and fomites, have been shown to be contaminated with high-risk HPV. This begs the question of how safe are the healthcare workers and the patients. This in turn highlights the importance of appropriate disinfection, because if disinfection is not carried out properly, it puts healthcare workers and patients at risk. So our recent publication used methodology that allowed us to mimic as close as possible the clinical setting. Healthcare workers will be able to relate directly to this method rather than trying to decipher scientific equivalents used in testing, such as carriers and suspension tests. The use of these chlorine dioxide wiping systems enables flexibility in the clinic. There is no capital outlay costs, no maintenance fees or electricity needed. The system can be used pretty much anywhere. So this slide just gives you a brief step of the methodology, which we'll go through one at a time. Basically, it shows growth of the virus, contamination of the device, disinfecting the device, and then analyzing the efficacy of the disinfection. So the virus used in this study were grown according to our previous published protocols, which are available in the scientific literature. We've been growing, we were actually the first ever to grow authentic HPV, infectious HPV in the laboratory. And we have literally made hundreds and hundreds of batches of virus, and we've done many studies about its stability, about its infection, about how to block its infection, and so forth. So let's go to the next step. The virus and organic soil are mixed and then added onto the instruments. And in our case, we use the transvaginal ultrasound probe and an endoscope. So we would mix the virus and the organic soil together, and we put it on these devices and then left it to dry, which takes about 30 minutes. So this is what we call the contamination step. The virus was added along the length of the insertion tube, the section of the device that is exposed to the patient. Normally, a sheath or a condom is used during clinical procedures, which protects the device and the patient. However, during examination, the occurrence of microabrasions, perforations, or breakages are widely documented in the scientific literature. By negating the use of a sheath or condom, this test provides a worst case scenario in case the cover breakage or inadequate cleaning occurs. The devices all have crevices and curves that mimic the real environment. And so this demonstrates that our studies are reflecting the complexity of the disinfecting a real medical device. The devices, once they have the virus and the soil dried on them, they are disinfected according to the user instructions. The contact time for disinfection is 30 seconds. Once the contact time was completed, the devices were neutralized to stop any residual chemistry from having microbial effects. The devices were then scraped to remove any remaining virus, and the eluate was collected. The solution was then added to healthy cells and allowed to incubate to assess any remaining virus still viable. After the incubation time, the cells were tested for HBV transcriptional activity, representing any active infection in the cell. So this slide shows the results we got. The TriStol products were able to achieve a greater than 99.9% reduction in viable HBV. This is the reduction required by regulatory agencies such as the FDA and the EPA. The differing log reductions seen in each of these tests is due to the different starting virus titers in each test. And you can see here we tested both HPV 16 and HPV 18. There was no reduction in either virus on the devices that were not disinfected. This shows that the virus was not just dying on its own, but rather as a result of the disinfection step. So what does all this mean? Well, it shows that the TriStol products are efficacious against HPV. More importantly, they are effective in a setting that mimics the clinic. They're tested on real devices without a sheath or a condom involved. Most importantly, though, that TriStol is one of 3 medical instrument disinfectant brands that can claim efficacy against HPV. The only brand in the world, though, that can demonstrate efficacy against HPV as proven by this novel testing. So this ends the presentation. I hope it was informative, and if you have any questions, I hope that you get in touch and we'll try to answer any of the questions you may have.